Hello, I'm sure that everyone has been to a doctor's office or a hospital at least once in their life and interacted with a doctor. How did they make you feel? Did they make you feel rushed through your appointment with no eye contact and not listening to anything that you had to say? Or did they actually take their time and sit down with you and go through everything in a way that made you feel comfortable? In this speech, I touch upon nonverbal behaviors of providers and how it directly affects patient satisfaction. I'm going to go in depth on a research article that was conducted by Dr. Charles H. Griffith and staff about nonverbal communication and patient satisfaction. The 3 points that I will be touching on are the researchers of the article. Then I will go into more detail on the study itself and explain the design of the study. And last, I will review the research findings. The first topic is about the researchers. The title of the research article that I am going to be talking to you guys about is How Staff Nonverbal Communication Skills and Standardized Patient Satisfaction, which is a study performed by mainly Dr. Charles H. Griffith III and Dr. John F. Wilson, who I will be talking about later in this speech. The first author is Dr. Charles Griffith, who is a board-certified doctor that got his medical degree from the Vanderbilt University in Nashville, Tennessee. He then did his residency in the University of Kentucky, which is in Lexington, which he still currently is working at. I got this information from his website, which is Griffith's Charles H. III, MD, General Internal Medicine in Lexington, Kentucky, updated 2016. The second author is Dr. John F. Wilson. He went to the University of Kentucky in 1977, and he is still currently employed there. Over the years, Dr. Wilson has been involved in collaborative research and teaching activities with faculty from all the medicine center colleges. His teachings related to medical behavior sciences and focused on communication and interpersonal skills, training, and on human responses to stress. This information I received from the website Board of Trustee Members, University of Kentucky, updated in 2016. Next, we will talk about the study design. This journal article focuses on body language and nonverbal communication from doctors and how it directly affects patient satisfaction. The objective was to examine the association of physician nonverbal communication with standardized patient satisfaction in the context of a quality interview. Trained standardized patient satisfaction recorders rated physicians' nonverbal behaviors, for example, their body lean, eye contact, tone of voice, nodding, facial expressions, in 3 encounters. The study took 59 residents, 3 completely different scenarios, which included only women, and the first being a medical situation where the patient complained of chest pain. The second was psychosocial, where it was a depressed woman and she had a history of sexual abuse. And then the third was just a counseling encounter to go over the preventative risk factors for HIV. Then the patient rated the encounters after, rating the interviews 1 through 7, 7 being the best score and best nonverbal communication skills. Multiple approaches were used to investigate the association of physician nonverbal behavior with patient satisfaction. I got this information from the article itself, which is Griffith, Wilson, Langer, and Haste article from 2003. Healthcare providers should care about this issue because patient satisfaction scores basically state how comfortable a patient feels with the healthcare provider. If a patient doesn't feel comfortable with the doctor and the nonverbal communication, then they're less likely to disclose information to them and follow through with treatment plans. Also, the scores will affect the providers personally and the clientele, and they may even lose some patients. So I'm going to show you 2 pictures. One is a bad doctor-patient relationship, which is right here, and it is the patient is waiting, and it looks like he's just about ready to leave the office. He doesn't want to even deal with the doctor. He's standing with his back to him, looking at either the chart or the computer, and it just doesn't look like a good relationship, to me at least. It looks like non-verbally he's just really not interacting well with the patient. And then this is a good patient-doctor interaction where she's at eye contact with the patient. She's using touch to comfort her eye contact, and she's smiling. So it just looks like a really nice patient-doctor relationship right here. So next we're going to talk about the study design. We're going to talk about, the last thing that we're going to talk about is the research findings. As said in the discussion section of the article, greater standardized patient satisfaction was strongly associated with better nonverbal communication. In all three types of patient encounters, there were some limitations to this study that should be taken into effect in future studies. First, the patients were standardized rather than them being actual real patients, although the evidence suggests that even if they were real, it would still come out to the same exact results. And then another thing is that they didn't use both genders, they only used one gender. So if they did both male and female, next time maybe they would have different outcome. A similar study was conducted in 2011 that was slightly different. The purpose of the study was to assess the role of nonverbal communication and verbal communication skills on evaluations by standardized patients during a structured clinical examination, saying that both verbal and nonverbal communication skills are central to the development of rapport between patients and healthcare providers. Each interview was videotaped and evaluated on 14-item verbal and 8-item nonverbal communication checklist, and the relationship between verbal and nonverbal communication skills on interview evaluations by standardized patients were examined using correlation analysis. The results stated that maintaining adequate facial expression using affirmative gestures and limiting both in purposeful movements and hand gestures had significantly positive effects on perception of interview. This information I got from the article by Collins, Scrimmer, Diamond, and Burke from 2011. So in conclusion, I believe that the take-home message from this speech is that when a provider has an interaction with a patient, no matter how long it may take for the provider, it is extremely important for them to have really good verbal and nonverbal communication skills, and it increases patient satisfaction tremendously. And in turn, patients will follow up with their appointments. They might adhere better to their medication. And I think overall, just patient satisfaction will just be much better. Thank you for watching.